I want to bring in Dr. Amesh Adalja. He specializes in infectious disease and emergency medicine at Johns Hopkins. Doctor, good to see you. It's been a while. We appreciate you joining Top Story tonight. So we know this virus is typically spread from rodents to humans, but the strain known as the Andes strain can, in rare cases, be transmitted from person to person. So do you think we're seeing person-to-person spread here, and how concerned should we be about that?
I think it's very clear that there is some person-to-person spread that's gone on that ship, just based on the dates of when people got on the ship, when the ship disembarked from Ushuaia in Argentina, and the fact that we're now hearing about the initial couple that were infected doing things in Argentina in the height of a high season for hantavirus, and they likely got infected, or at least one of them got infected and brought it on board and then spread it to some of their close contacts on the ship.
Do we know how they got infected? I mean, people say that it starts with rodents, but how do people get it?
People get it when they're in contact with the droppings of rodents. So classically, in the United States, where we have about maybe 50 cases a year, including, recently Gene Hackman's wife died of hantavirus in New Mexico, it's usually when you're around those droppings and you're maybe cleaning out an old attic or cleaning out a shed, and these things get aerosolized and you inhale them. That's how people usually get sick. We know they were bird watching and doing other outdoor stuff in an area that's endemic for hantavirus. There's already been 40 cases plus that have been documented this year in Argentina.
Yeah, we're looking at a graphic now. I don't know if you can see it on our screen as well, but it kind of shows a little bit how sort of this can be transmitted. Two people who had gotten off the boat are sick and have been hospitalized. One is in Switzerland, one is in South Africa. Could they have passed this virus on to others who might not know it yet?
So even though Andes is something that can transmit from person to person, it's not easy. You don't get it casually the way you get COVID or certainly not like measles. This is something that requires prolonged close contact in order to transmit between humans, even if it has that capacity. So this isn't something that we expect to see many secondary cases occurring. They certainly are a possibility, and they need to be ruled out, and people need to be contact traced and contacted if they were in contact with a case patient. But I don't expect we'll see explosive secondary spread, just because it's not a very efficient spreading virus.
Yeah, the incubation period for this virus can be several weeks with people not showing symptoms right away. How much does that complicate the contact tracing here on the ship? 150 passengers.
Well, it means that you have to watch people for quite a while. That doesn't mean that they have to be quarantined. It means that they have to have some kind of check-in with health. They could take their temperature. People can keep a journal of what symptoms they're having. But it is going to be a process of 40-plus days that you have to watch individuals that are close contacts. And I don't know that all 150 people on that boat qualify as close contacts. It's probably a subset of them that actually had contact with those 8 case patients.
Do you think it's a good idea to get the remaining passengers off the boat?
Yeah, it's been a good idea to get the remaining passengers off the boat. They should have been able to disembark at the Cape Verde Islands. I think it was a mistake not to let them do that, because what you're doing is increasing the dread factor, making it harder, especially if there are cases there. We know that there were sick people that just were evacuated today to the Netherlands from the Cape Verde Islands. That increases the risk of transmission if you keep people around infected individuals. So they should have been able to disembark. Hopefully they will be able to in the Canary Islands.
Yeah, and then I do want to ask you some of the symptoms, just again, remind our viewers some of the symptoms of this disease.
So it starts out just like any influenza-like illness: fever, chills, muscle aches, and pains. And the real danger symptom is shortness of breath, as the lungs will start to fill with fluid as the blood vessels get leaky. That's what you really worry about, someone getting into trouble with the disease.
Yeah, it sounds like scary stuff. Doctor, we thank you again for joining Top Story. Good to see you again.